Hello and welcome to the second EBM session. Today we're going to be talking about therapy and how you can do searching in PubMed for that. Usual disclaimer. Now what we will look at in this lesson is we're first of all going to review your diagnosis homework from a couple of weeks ago. Then we'll go over finding answers to background questions using some resources that we provide in the library. These are Access Medicine, Clinical Key and Micromedics. We'll look at searching PubMed, which you've done before, but this time we'll do it using the MESH database, which is a particular kind of searching technique. And then finally, we'll look at finding patient education information using Access Medicine, Clinical Key, and Micromedics. So just to go over your diagnosis homework quickly, by and large, you all did a pretty good job. A couple of things to mention. One is your PICO. Remember that they are different things. They're separate, so don't confuse them. Now, an intervention is think about it this way, is the new technique you're going to use, whereas a comparison is the old technique, the standard technique that you are going to compare it with. In terms of searching, it doesn't matter if you get them around the other way, but a lot of clinicians will say you need to know exactly which one is which. So the intervention is the new thing you're going to try this time. The comparison is a standard technique or a better established one. Now, don't combine your PICO elements. A few people would say the intervention is A, and then they'd say the comparison is compare A with B. No, the intervention is A and the comparison is B. That's separate. You don't need to describe the comparison that you're doing. And lastly, for your O, the outcome, remember patient concern. Sometimes they may seem kind of secondary, or they become apparent when you're doing the searching, how to address them, or they're obvious. But remember to at least include them in your description. If a patient specifically says they don't want to do some particular thing, or they're worried about a particular thing, then that is part of the outcome that you're looking for. Now here's an example of the diagnosis homework PICO. I described her as a 12-year-old female. She had fever, abdominal pain, nausea, lower right quadrant tenderness. Now those are the clinically relevant features of our patient. Her age, her gender, I don't know if that's really relevant, but it's the sort of thing you'd think about, especially with abdominal discomfort. I'm describing her symptoms on the assumption I don't know exactly what it is, although a clinician would tell you that lower right quadrant tenderness is very indicative. My intervention is the CT scan. That's a new technique I'm thinking of using, as opposed to a more standard technique. That's my comparison, the ultrasound scan. And then finally my outcome, which is often the hardest one to put into words. I'm talking about an accurate diagnosis of acute appendicitis and then it depends a little bit on what your take on the situation was, minimal delay because you're in a hurry, or you could take it as being exposure to radiation, which is obviously going to be the ultrasound one. Now, that's the one that's the vaguest, and once again, you might want to think about what does accurate mean? Are you thinking about sensitivity or specificity or what? If you put all that together to make a clinical question, we suggest that you actually follow the recommended sentence structure that we give you, not because you can't do it another way, because that way just means that you'll tend to be pushed into doing it and producing a functional question. And remember to include all the PICO elements you've got. Don't leave out anything. Okay, so putting it all together for this one would be a fairly lengthy sounding question. In a 12-year-old female with nausea, abdominal pain, fever, and lower right quadrant tenderness, does a CT scan or an ultrasound scan result in a more accurate diagnosis with minimal delay, radiation exposure, whatever it is? Okay, now that last part is up to you depending on what your take on that question was. Search strategies. Don't mix your concepts in your search strategy. For instance, look at these two examples here. You've got a CT scan or computed tomography and ultrasound or ultrasonography. So that's comparing two different techniques. And I don't mind what I call either of those techniques, CT scan or computed tomography and ultrasound or ultrasonography. You need at least one synonym for I and C. What a few of you did was you kind of mixed them up. So you put your I and C in the same set of brackets. So you said CT scan or ultrasound and computed tomography or ultrasonography. What that means is the first search requires at least one synonym for I and for C. So you have to have both concepts. The second one requires either two synonyms for I or two synonyms for C, or one synonym for both. In other words, it mixes them together and ends up giving you more results. Now we can see what that looks like here. I've got a search done in PubMed, and you see up the top there it says appendicitis, CT scan or computed tomography, and ultrasound or ultrasonography. I put on some filters, and down here we see that I get 709 results, which is a fairly decent number of results. However, if we do the second option, which some people used, appendicitis, and then mixing our two techniques here like that, once we apply our filters, we end up with in excess of 1,500 results. And that's simply because we are actually getting results that only talk about one of these techniques. The last thing is filters. People tend to like using filters. They apply them a lot to chop down their results when they think they have too many, or because they think it focuses the search. And it does do that, but it is a very blunt tool. If you're going to use them first of all to address your PICO. It's hard to describe a patient using keywords, so use your PICO to do it. And last example, it was female and the age of the female. Okay, that's it. That narrows it down to your patient. If you are using them, add them one at a time and see what happens. Okay, if they don't make a difference, don't bother putting them on. If they wipe out your results, think about them again. So do check that they actually do make a difference. Now, a lot of people like using the date filter, but it's often unnecessary, so that people like to limit to the last 5 years or the last 10 years. But honestly, don't do that for two reasons. First of all, you can list the most recent papers first in the search results, so you automatically see the most recent research. Secondly, for a surprising number of conditions or interventions, the research, the really important research, may be more than 5 or 10 years old. And if you limit to the last 5 years, you simply don't even get to see it. So be careful about that date filter. By and large, you don't need it unless you are truly, truly overwhelmed with old results. Lastly, the clinical trial filter. Really only apply this if the number of results you get is overwhelming, or you are being swamped with results that are clearly not clinical trials. For example, if you're simply awash with case reports and you want to narrow it down to clinical trials, go ahead and try it, but actually see what it does. Don't just apply it as a matter of course because you think that's what you need. Actually see what it all looks like first and then apply it. Now, today's therapy session, our clinical scenario, we're going to present it to you as a video, which you can see here. It's in YouTube. Follow this link here and just watch that for a couple of minutes. Now, I'm sure you enjoyed that. So here's our clinical scenario. We've just written it out here, so you've got some idea of some of the terms that are being used here, such as granulomatosis with polyangiitis and so on. If you don't know what they are, here they are written out, so you can actually find them again when you're looking for them. Now, make sure you understand the search, the situation, what you're looking for. We have a patient with a particular condition, particular clinical results associated with her. She's been using one drug, wants to know about using another one. She doesn't know whether this is safe or not. Now, just to remind you of what our process is here, we've got a clinical scenario. The first thing we do is write out and answer background questions. For example, do you actually know what GPA is? Do you know what a GPA flare is? What is rituximab and how does it work? What is cyclophosphamide and how does that work? These are the sorts of questions you would answer. Once you know that, formulate your PICO, decide which database to use to do your searching. We're going to use PubMed. Do the search and review your results. Now, to answer those background questions that you might have, today we're going to show you a couple of, three different databases. They're available through DLib. One is Access Medicine, which you may or may not have used. There is a variation of it called Access Pharmacy, which is essentially just a more focused subset of it. And then there's Clinical Key, which has a wider range of material in it, we'll see in a moment, but it also includes drug monographs, which are summaries of information. I'd also point out that these things, besides answering your background questions, can be useful for patient information, and we'll come back to that later. Another one we'll look at is micromedics. Now, this is a drug-oriented database. There's actually several drug databases combined, I believe. It has a variety of tools that are very useful when you're specifically interested in looking at drugs. There's a particular way of comparing drugs for comparing their functions and dosing and so on, or side effects. You can look at drug interactions. There are dosage calculators and so on. You can search not just for the drugs, but for classes of drugs or for conditions. And once again, this one also provides very specific, professionally produced patient information. Now, to find these resources, here we are on the DLib homepage. If you scroll down, Access Medicine and Clinical Key are available right there on the homepage. Micromedics you have to search for on the DLib catalogue. It's IBM Micromedics, and you just click on Database and you will get to it there. Now we're going to look at Access Medicine. When you get here, essentially it presents as a collection of medical textbooks. Up at the top here, you can search for books in particular or quick reference guides. There's a particular drug search and so on. It'll produce cases, you'll have videos and things, all sorts of bits and pieces. And notice here, patient education. The flyer is specifically written with patients in mind. Now I'm just going to do a search in here for cyclophosphamide, which is one of the drugs we're interested in. Cyclophosphamide. It comes up with all sorts of stuff. So there are book chapters on it. These are from textbooks, tables about various things. If I'm particularly interested in just looking for information about the drug, I can click on the drugs limit there, and it gives me those listings here, which are the ones that showed up first. If I wanted to do some background reading on it, I could look on book chapters, and it would pull out the chapters from the various books that are in there, and there are quite a lot of them. Now, Clinical Key, it's very similar in concept. It includes a lot of research material as well as other things. So when you have the search box here, there's all types, that's the default. There are books, there are journal articles, clinical overviews, all sorts of stuff. And there's our important patient information. Once again, probably I recommend just do your search. Cyclophosphamide. There we go. Now you can narrow down once again, just as you did with Access Medicine on the sides here, looking for drug monographs or books and so on. Here's the drug monograph for cyclophosphamide. If you click on that, it'll give you a couple of different things, but usually what it is a single report like this saying, talking about dosage, administration, interactions, adverse reactions, and so on, and then lots of references for where that information came from. Now, our last one I'm going to show you is Micromedics, which is a drug-specific database. Once again, a simple interface here. Allows you to do various specific searches up here, drug interactions, IV compatibility, can you give a drug using an IV, comparisons of drugs, care notes, which are patient information. Once again, remember, this is a very good place to get professionally written, accurate information that you can give to a patient. There it is, and it does prompt you for other things that you might want to look at, but I'll just do that. And this presents you with quick answers, which are basically the ones where it gives you the hardcore information that you need to know. And you can see there are a lot of different things down there, all about from how it's supplied, different names it comes under, its pharmacokinetics and so on, all the stuff you might use. In-depth answers are essentially the same material but in greater detail. Okay, and they take a bit more looking around, pointing towards different conditions and maybe different versions of the drug. Now, to actually get on to the searching part of this, you've done your background questions and answered them to your satisfaction. You've come up with a PICO and so on. Now you can do searching in PubMed. We did keyword searching last time. This time we want to show you using MESH, that's medical subject headings. Now this is a specific system in PubMed designed to make your searching both more thorough and more accurate. We have a video for this. If you go to the Canvas module, EBM Section 2 Therapy, and look for the page called Mesh Video, you can watch that. So MESH and PubMed. Now, just to summarize a couple of things, medical subject headings, this is what's known as a controlled vocabulary. So they allow for very precise searching that is surprisingly comprehensive within each topic. So useful for subjects that have many synonyms, for instance, drug trade names. If you're looking for acetaminophen, not only would you, if you're using keyword search for acetaminophen, you'd look for paracetamol, Panadol, and all the other trade names that it has. If you use MESH, you just look for acetaminophen and it automatically finds all the other ones as well. This is useful for when you've got search terms with multiple meanings. For instance, nursing is a searching term that you could use, but when you look for it, do you mean nursing as in the job that a nurse does, or nursing as in breastfeeding? You can use MESH to distinguish between the two. Be aware that MESH is not always suitable to use. Sometimes there simply isn't a MESH term that you can use, and this is often the case for very new subjects or subjects that are very rare and there's just no point in having a MESH term. Now, patient information, we showed you Access Medicine and so on, and Clinical Key, Micromedics. Just to remind you, you can actually go to these resources to find patient information. Now here's Access Medicine. It has a variety of patient education resources here. Click on there. Now, as it happens, I'm not sure if it has anything on cyclophosphamide, but you see there's an alphabetical listing there. If we go to Clinical Key, we can just go down here, Patient Education, searching for cyclophosphamide, and there's a patient education thing there. And you'll note there are a couple of different ones depending on what you're actually doing. So here's one for our particular condition. It's not so much about cyclophosphamide. This one's about managing another condition. This is if your patient is taking tablets or if they're having an injection. Lastly, over here, cyclophosphamide in Micromedics, we have care notes. Now, if we click there, we get a different little search here. Do our search. And we get cyclophosphamide, the injection or the tablet. Choose whichever one you want. And you may find that you get a choice of a couple of different languages. Usually it's English or Spanish because this is American oriented. We'll just click on English. And there we go. So don't forget about patient information. Patients will, in the future, always be asking you, can you give me something to read about this? Can I take this home to show my husband, whatever? It's very common and you shouldn't underestimate. And these resources are trustable resources which are, by and large, much, much more reliable than a patient going home and simply Googling the drug or their condition. Thank you very much for watching.